I chose George Washington University because it showed a strong competency in the business core curricula, and I felt that would be very good with my undergraduate training in public accounting. The standout courses and events that occurred when I was at the George Washington University begin, of course, with the Fred Gibbs curricula in business theory. You know, everything seemed to follow that lead, and that was very, very stimulating. I enjoyed all the courses. The faculty was quite competent at that particular time, and everybody was looking to bring together a curriculum that would be most useful in the hospital industry at that moment in time. Well, when you ask questions about Fred Gibbs, everybody has their own stories, as do I. And the story that I tell frequently with Professor Gibbs being my Mr. Chips, he'd always jingle change in his pockets when he'd teach, and that was a little bit distracting if you allowed yourself to become distracted in his course. But I recall looking at an organization chart for the Sears Corporation while I was in class, and it was a very flat organization chart with a broad span of control, and it wasn't consistent with the pyramids that we were learning and were comfortable with. So Professor Gibbs asked the question, well, what do you think of this chart? Implying that he wasn't too satisfied with the broad span of control. And I raised my hand with great trepidation and said, but the company's doing very well. Who cares what the chart looks like? And I was about to run from the class because of the retribution I expected to hear. He didn't comment. He just sort of grinned a little bit and went on with his lecture. And I tell that story frequently. Seconding my great pleasure with the academics of Fred Gibbs, Leon Ginsick was in the program at that time too, I believe inappropriately as the associate director of the program. A very stimulating professor, a great compliment to the direction of Fred Gibbs, and a Dr. Page in the business school. I think he went on to become the dean of the business school subsequent to my attendance, but he too was quite enjoyable. My residency experience began with my selection to apply at the Fairfax Hospital System, where I went one morning in a snowstorm. It took me 2 hours to get there, and only to find out from the CEO that there was some miscommunication with the university, and they were not going to take a resident that year. I was heartbroken because I thought that I might have been selected for that particular residency to fit my particular needs, and it was a good residency. So there I was without a residency, but as fate would have it, I subsequently was chosen to go to the Nassau County Medical Center on Long Island, New York, a large public 600-bed hospital. And I did my residency there, and I stayed for another 11 years, working my way to the administrator of the facility. I got a vast education, and it was a great foundation for my career. I was very interested at one time to go on to my PhD, and that kept me academically prepared. I, of course, followed the steps of the American College of Healthcare Executives, and think I obtained my fellowship at the minimum number of years required. I would regularly do my continuing education with the American College of Healthcare Executives, and that continued well past my fellowship. I did, when it was part of the advancement step, I did the oral examinations for the college, and at one time I can recall writing a few questions for the written examination. I was equally well positioned to teach throughout all of my career. I had adjunct faculty appointments at the Long Island University program in New York City, the New School for Social Research. I guest lectured at the George Washington University and at Columbia University. And then when I came here to Miami, I continued my adjunct faculty appointment at the program at the Florida International University. And that had to keep me abreast of what was happening in the industry, because none of us would ever want to be embarrassed by a question from our students. As I look at the healthcare environment right now as a guide as to what type of people will be successful in the management of that particular industry, I think it's a time for people to be generalists more than to be specialists. Certainly we have the IT specialists, and we've generated the financial specialists, but we are cutting edge in things like stem cell research and other components of healthcare. I have the opportunity to see that at the University of Miami Tissue Bank, where the doctors talk in just rhetoric terms about growing tissue and making bone and replacing body parts and healing damaged organs with just the injection of a person's own stem cells. I think that requires an individual who has broad thinking capacity and not tunnel vision or microscopic vision. So I would think and hope that the managers of the future would have that broad spectrum to have a feel for everything that's going to be brought to bear on the health of our population. Students coming into the graduate training of health administration are so fortunate, but at the same time, they are so significantly challenged by the industry at this moment in time. The guidance I would give them is to consume as much as they can as to what's happening in the industry, stay close to the materials that are developed, speak to mentors and leaders whenever the opportunity exists to get guidance and get direction. It's an all-consuming industry, a far cry from the cottage type of industry that it was when I entered. I always remained close to the George Washington University program, closer sometimes than others. I was once the treasurer of the Alumni Association. I remained active, I remained on mailing lists, and as I have mentioned, I still to this day keep in contact with a number of classmates and others with whom I've had contact. I think that's invaluable. I think it's a contact with colleagues who can be more candid in our communication, not only about what's going on with the industry, but also how we as career-directed people are behaving in our career development and our career activities. I think the George Washington University program provides a loyalty among that cadre of people that allows us to keep our focus, to keep our careers properly directed, and to just have good friendship as we move down the, our particular career. I have found it that way, and I have been particularly pleased that it has served in that particular fashion. I have always been a believer in the profession as something that has contributed to what we do, and in that regard I have stayed very close with others. I have been active in New York with the New York State, the Hospital Association of New York State. I have been chairman of the Florida Hospital Association during a very difficult time, the arrival of the for-profit industry in great numbers, and contributed in a very small way to the merger of the for-profit industry into the Hospital Association here in the state. And to this day, I still enjoy good camaraderie and collegiality with the other hospital administrators and healthcare administrators in this community. So collegiality within the leadership of the industry is an area where I would hope to be remembered. And secondly, to the furtherance of education within the industry. When I went into the George Washington University, there was only 15 graduate programs in the country. I know that I'm dating myself. There are now in excess of 200 programs in the country. And I have had, in a small way, the opportunity to mold those programs, at least locally, okay, into the creation of valuable degrees, platforms of knowledge that bring people into the industry who are increasingly competent. So those would be the two things that if I should be remembered for anything, would be the things that might be mentioned. I don't know that the George Washington University will be enhanced by my experience following my master's degree from the George Washington University, but I'm just another student who did well as a result of the excellent education and career values that were implanted in me at that particular moment in time. I can say without question that I was in the right profession for all of my career. I was fantastically satisfied and stimulated to the very end and to this very day. Here I sit, you know, some 10 years after completing my formal career in health management, and I'm still consulting and teaching and finding it exciting every day. When asked for a concluding comment on advice to those who might be entering this particular profession, I am hard-pressed. The demands are so great now, both in terms of skills and personality traits, that one has to really truly inventory themselves as they make a move into this particular industry. Cutting through all of that thought, I would identify the ability of an individual to communicate honestly in whatever forum they happen to be in. People are impatient today. They want to get to a conclusion quickly. We're forced to give opinion more often and a lot faster. I think the need to pause and collect thought and communicate crisply and honestly is of vital importance. And I would put that high on my list of qualities of somebody coming into the industry.